The trouble with epilepsy is that it is a very complicated disease. People come to it at many different ages. They come at it from many different causes. They come at it with many different requirements as individuals. And not acknowledging the complexity of all those things, it can be a tremendous disservice to people. And stopping seizures. All too often the word control gets used. And I really kind of came to hate the word control very early in my career, because the word control meant not as bad as last month and, haven't been to the emergency room too many times. When people said control, they weren't talking about being seizure-free. They were talking about something that was quite a bit less than that. And that it would be reasonable for physicians who were trained in the last 50 years to not recognize that the whole process of seizure freedom has become much more likely. When I trained in the treatment of epilepsy, we had really about 4 seizure drugs that we could use. At the time, maybe 5, and that was it. Lots of people were not seizure-free. I'd been introduced to surgery for epilepsy, but even in a center that actually I think did a good job at doing surgery for epilepsy, it was used very little. And that was tremendously unfortunate. And so, telling patients, look, seizures are not acceptable. I mean, they will take away things from you. Even a single one, people will say, yeah, I had a few days where I wasn't quite clear, and I don't know that I ever got all the way back to where I was. And so that's just not acceptable. That's not what I would want from my family. That's not what I would want for my best friend or neighbor. And you shouldn't want that. Patients shouldn't want that. They should be, if you're treating something, it's supposed to be treated. That means gone. If you still have high blood pressure when your high blood pressure medicine doctor is giving you blood pressure medicines, he's not done yet. And until somebody with epilepsy is seizure-free, we're not done yet. You got to bring that kind of intensity to this process, because there's a great deal of apathy that exists out there that's not possible for many people with epilepsy, and it's utterly wrong. And it has to be what drives you every single day to be doing this.